sitting in a hotel lobby in Iraq in 2007. I was working on my laptop when my waiter brought me a cup of chai. He said, "Excuse me, sir, can you help me? I have a cousin, and he has a little girl who was born with a life-threatening heart defect. And you know, there's not a hospital or a doctor in all of Iraq that's equipped to save her life. You're an American. Is there something you can do?" I just moved to the country a few months earlier. I'm not a surgeon, to get that out of the way now. I didn't know anything about heart defects. I didn't know anything about sending children outside the country for treatment. So from the very beginning, this guy's very sincere request seemed utterly impossible. And she wasn't the first child I'd met in Iraq who was born with a life-threatening heart defect. In fact, it seemed like everyone knew someone with a child who was born with a broken heart. And so it was in this context of war and worried parents that I began coming face to face for the first time with this reality, that violence unmakes the world. It doesn't just beset us, it actually unmakes us. And I began dreaming about a way to set the world's wrongs to rights again. Now today, I'm 5 years into an experiment, a lifestyle, a philosophy that I call preemptive love. Now, unlike a preemptive strike where I seek to get you before you get me, preemptive love is where I jump forward to love you before you love me. I jump forward to trust you before perhaps you've trusted me. Because we all know that violence unmakes the world. But preemptive love unmakes violence. Preemptive love remakes the world through healing. So ultimately, I decided to help this little girl. I decided to suspend my questions and to jump in and love first. Because I had to understand why she and so many others like her had been born with these life-threatening heart defects, why there were so many of them, and why so little was being done about it. I'm here to talk to you about that today in 3 ways. First, I want to tell you a few ways in which violence has unmade the world in Iraq. Secondly, I want to share with you a few stories of preemptive love. And third, I want to answer the question, so what? By the time we're done here together today and you leave, I hope you'll see this idea of preemptive love is not my idea worth sharing. It's an idea for all of us, and it's worth living. First, I want to share a few stories of how violence has unmade the world in Iraq. We found 3 top suspects for the soaring rates of birth defects in Iraq. Now, this list I'm about to show you is extraordinary. These are factors that are not common to all the nearby countries in Iraq. First of all, Saddam Hussein's usage of sulfur mustard gas in acts of chemical warfare against the people of Iraq. Where mustard gas was used, research shows a 400% increase in the incidence of children born with heart defects. Secondly, U.S.-led sanctions against Iraq in the 90s led to a destruction of the very healthcare system that was needed to care for sick children. Ministry services fell apart, food became undeliverable, and ultimately hundreds of thousands of women fell malnourished, many of them pregnant, leading to a 200% increase in the likelihood that their children would be born with one of these life-threatening heart defects. But my quest to understand why there were so many children in Iraq born with heart defects led me to a third thing for which I was totally unprepared. As I started hearing about American soldiers who were raising their hand saying, "My child was born with a birth defect." And then I learned about depleted uranium munitions, something I'd never heard about before. Munitions that were employed by U.S. and British military. Now, when these munitions explode, when they make impact, they vaporize and they allegedly begin to create both a chemical and a radiological threat to the environment in which they're used. Now, I'm not a scientist, so I'm careful to not make any explicit claims here. Really, I'm like most of you guys. I'm a parent. So it kind of doesn't matter what the cause is. Just let me speak as a parent. When I travel to Fallujah and fathers there tell me that 1 out of every 7 children is born with a birth defect now. When doctors in Basra tell me that Cancer rates have reached levels higher than Hiroshima. When published research tells us that heart defects are occurring in certain places in Iraq at 10 times the world average, as a parent, I'm deeply affected by that. And so that's ultimately why I decided to start the Preemptive Love Coalition, for that little girl that I met in the hotel lobby, and for the tens of thousands of children that are standing in line behind her without a solution. We're now the first and the only organization in Iraq that's seeking to eradicate this backlog of children waiting in line for life-saving heart surgery. And from the very beginning, really what we've been trying to prove, what we've been trying to articulate is this one thing: preemptive love unmakes violence and remakes the world. I first saw the effects of this thing I'm calling preemptive love in the eyes of this guy, Shad's father. Kurdish taxi driver from one of the northern cities of Iraq. He just had a great spirit about him, and he was willing to do anything to help his son, Shad, get the life-saving heart surgery that he needed. But I gotta be honest, he was a little bit leery with the solution that I put forward for him. I wanted to take his son to Turkey. And due to a long-standing conflict between the Kurds and the Turks, he was terrified of this proposition. Going to the enemy, or leaving his son to die. Unfortunately for the family, we were their last resource, and a Turkish doctor was the only one willing to put his reputation on the line to save this kid's life, one who was so far gone with such a complex heart problem. So within just a few weeks, we had Shad and his family on a plane to Istanbul. Really generous staff at the hospital stayed late one night to receive us, ran a bunch of tests, intake forms, and all that, and then I was asked to take Shad downstairs, where the doctors looked at him from every angle, trying to assess whether or not he was suitable for surgery. After about an hour of these diagnostic tests, a lot of discussion ensued about what would happen, and I was sent back upstairs to Shad's father to convey the message. And I remember really clearly the hospital was eerily quiet at that late hour. I think he must have heard me coming down the hallway, because he was standing outside his room waiting for me when I rounded the corner. And he had that worried look of a father on his face. And he said, So is my son going to get his surgery? What'd they say? And I think he saw this before I could get my words out, because just moments later we were hugging in the hallway and jumping up and down and celebrating these amazing Turks in their wonderful hospital of hope. Next day we had him in surgery. It was a difficult surgery. The doctors were really, really pleased with the outcome. Shad was passed on to ICU. Things went well, and within just a day or two in ICU, he was discharged to his room. And that night in his room, he confided in his dad how excited he was to get home and lay in his mom's lap. How eager he was to see his little brother and his little sister again, now that his heart had been made well. And then, as quickly as he'd been made well, a blood clot went to his artery and sent Shad into his third and then his fourth surgery in just a matter of a week. I got the call in the middle of the delirium of Saturday morning. Shad had died. I got dressed and I taxied to the hospital as quickly as I could and escorted his dad into his bedside in the ICU. And I remember hearing his dad say the most devastating words I've ever heard. "Oh, Shad, you were like 7 sons to me. You were like 7 brothers. What am I going to do? What am I going to tell your mom? What am I going to tell your grandmother?" And so much was dashed in Shad's death. This boy that we loved was gone. I mean, as the guy responsible in part for it, I couldn't help but thinking that there might have been another kid out there that we could have helped in his place. What to think of that? And this story that we were trying to write, this story of peace that we were trying to forge between the Kurds and the Turks, was about to fail as Shad's dad began the inevitable blame game. This violence that gave rise to Shad's heart defect, or at least prevented the treatment of it from so many years, it was still at our tail, still unmaking the beautiful world around us. And then something amazing happened. Shad's dad didn't blame anyone. Instead, he walked around to every nurse and every doctor who helped his son, and he looked him in the eye and he said, "Thank you. Thank you. I know you're sad. I know you didn't want my son to die. You tried. You gave us a chance. Thank you." It was so beautiful, so healing for all of us. Any sense of guilt just fell away. It staunched the bloodshed that existed, if only for a moment, between these two communities that had been at odds. And all these doctors and all these nurses had gotten together and they were doing preemptive love. They were remaking the world through healing. Now, we went on to help 35 more children from Iraq get to Istanbul for the surgeries they needed. But it was of little consolation to me when one hospital in Baghdad alone claims to be turning away 80 children every single day from the life-saving surgery that they needed. I realized to keep our commitment to eradicate this backlog of tens of thousands of children, we had to stop exporting the problem. We had to train Iraqis to do this job on their own. The numbers were never going to add up. So I got on the phone, my colleagues got on the phone, we started calling international doctors, trying to see what it would take to bring them into the country. And it was just like sitting at that hotel lobby table so many years before. I didn't know anything about bringing surgical teams into a place like Iraq. I didn't know anything about developing infrastructure in a war-torn country. From the very beginning, helping the entire nation of Iraq seemed impossible. But that was before we met this man, Dr. William Novick. Within just a few months of talking to him, he had a team on the ground, and we were conducting the first of its kind surgical and training mission. Now today, at this very moment, in the city of Najaf, we're in the middle of our 9th surgical and training mission. And we work in cities all across Iraq now. His team, the volunteers that they bring together, they come in and they do preemptive love and they unmake violence and they remake the world around them wherever they go. But really the biggest threat and the biggest opportunity for Iraq does not lie externally. It's a domestic issue. And that's why I was so thrilled to meet Noor and her family. Noor came to us from the Sunni city of Fallujah, long regarded as a Al-Qaeda stronghold, the heart of the insurgency. For many people, Fallujah became the symbolic heart of the entire war. So when Noor's father approached me and asked us for surgery, I was a little bit nervous. I felt a little bit bad because the best solution I had for him was in a Shiite city nearby where we were training Shiite surgeons. And I didn't know, would he allow the so-called enemy to operate on his daughter's life? What would you do? How do you make that decision? Luckily, Noor's father wasn't like so many others I'd met. He didn't beg for the easiest option. In fact, he ended up insisting that it be these so-called enemy surgeons that saved his daughter's life. Because he wanted his daughter to be made well, but he didn't want a healthy daughter in a broken world. He actually believed that Noor's surgery could pave the way for peace. And so as these so-called enemy Shiite surgeons brought his daughter out of the operating room, he said, we have to take this wall of fear that's been built up between us and we have to tear it down. And soon after that, Noor and her family, they went back to Sunni Fallujah, newly appointed ambassadors of peace, with a new story to tell about their Shiite neighbors just miles down the road. Now let me tell you a few things I don't know. I don't know if preemptive love is good foreign policy. Just be honest about that. I don't know if preemptive love can solve everything that's going on right now in Syria or Iran. Now let me tell you what I do know. From my experience in Iraq, preemptive love is great personal policy. I know that repaying evil with evil or violence with violence, it doesn't work. Still, preemptive love is not simple. I don't mean to give an impression that it's simple. It wasn't simple when I got the phone call from local security officials telling us that they had apprehended a man conspiring to blow up our office. When they said his name, I knew it immediately because his son was next in line on our surgery list. And we were faced with this critical decision. What do you do with the child? Does that disqualify him from surgery? We decided we wanted to be the kind of people who would even serve the child of a would-be terrorist. Because what better way is there to rewrite the narrative that drives terrorism? And so some will call preemptive love naive. I'm not proposing blind trust. There's absolutely a time to say no. And there's absolutely a time to say not yet. What I'm most concerned with is that as leaders, we be the people who suspend our suspicion and our skepticism. And that we be the people to extend trust. Because if we live skeptically and only by the principles of risk management, I fear that we'll miss the amazing opportunities to remake the world around us. Now, if you accept my challenge today and that of many others, and you jump forward in preemptive love, I can promise you, you will get burned. But in my experience, it's better to get cheated here and there than to never trust at all. A few years ago, I envisioned an Iraq where every child had access to the life-saving surgery they needed. Today, we're on pace to accomplish that in the next 10 years. So my simple question for you is, what's your dream? I'd like you to take a minute, if you will, and write down an act of preemptive love that you could do this week. An act of extending trust to another who perhaps hasn't earned it yet. An act of suspending fear in your life. I wonder, would that help you accomplish your dream? You know, some people believe that the world cannot change. They focus on the violence around us. I'm here to tell you, from my experience in Iraq, preemptive love unmakes violence. Preemptive love unmakes injustice. And preemptive love can kick out fear. And from what I've heard among you today, there's enough of it in this room today to remake Austin and the entire world around us beyond measure. Thank you.